So today, we're going to look at how one country is quietly trying to rewrite the playbook for global health. The goal? To make sure the mistakes of the last pandemic never happen again.
I mean, it's a question we're all thinking about, right? The last few years, wow, what a wake-up call. It was this huge, stark reminder that viruses couldn't care less about our borders. We all know another pandemic isn't a matter of if, it's when. So the big question is, did we actually learn our lesson?
And really, this gets to the heart of the matter. When COVID-19 hit, it just ripped the cover off all these deep cracks in our global system. We all saw it, right? We learned firsthand that if you leave any country vulnerable, you're putting the entire world at risk.
Okay, so when you think about the big players in global health, a few heavy hitters probably pop into your head. But the country that's really stepping up, trying to pioneer a totally new, much fairer approach, yeah, it's probably not who you think. It might just surprise you. All right, so first, let's really dig into the problem we're all trying to solve here. The pandemic didn't just make us sick. It did something else. It exposed a pretty fatal flaw in how we handle a crisis on a global scale. And this is where that failure was just painfully obvious. The fact that we developed vaccines so fast, that was a scientific miracle, truly. But getting them to people, the distribution, that was, well, anything but miraculous. So what went so terribly wrong? You know, the pandemic just threw these huge disparities into sharp relief. The big picture was painfully clear. Wealthier nations in the global north were buying up massive supplies of vaccines, basically hoarding them. And that meant countries in the global south were often left at the back of the line, just waiting. This wasn't just unfair. This inequity literally prolonged the pandemic, and tragically, it cost lives.
And here's what's so interesting. This wasn't just a problem over there. Not at all. Even a country like Belgium, with a world-class healthcare system, felt the squeeze. As this quote shows, they were also facing these critical shortages of basic medical equipment. That kind of vulnerability, that really hits close to home.
So that shared experience, that feeling of being vulnerable, both on a global scale and right there at home, that became a really powerful catalyst for change. For Belgium, the lesson was crystal clear. The system was broken, and they decided they were going to be part of building a new one based on a simple idea, that everyone, everywhere, deserves a fair shot at life-saving medicine.
Okay, so Belgium took this mission and turned it into a real, concrete strategy. They became what the World Health Organization actually calls a champion of good donorship. It sounds great, but what does that really mean? What does it look like in practice?
Well, for starters, it means putting your money where your mouth is. Belgium is the 13th biggest donor to the WHO's thematic funds. That's money aimed at specific health issues. That's a big deal. But there's another number that tells an even more important story about their strategy.
And here it is. This is the really crucial part. Belgium is the 8th largest contributor of something called flexible funding. And honestly, this one specific kind of donation, it's the absolute key to their entire approach. So what on earth is flexible funding? Well, think about it this way. Instead of earmarking money for one specific disease or one single project, this is core funding. It's money the WHO can use wherever it's needed most, right when it's needed most. It lets them be nimble, pivot to a new crisis on a dime. It's about building a partnership based on trust, not a bunch of restrictive rules. It's just a much, much smarter way to help. But Belgium's plan is about way more than just writing smart checks. They're going after one of the single biggest bottlenecks we saw in the last pandemic, the ability to actually make the medicine. And their solution is pretty radical. They want to share the blueprint. And they are absolutely backing this up with serious cash. We're talking about an €8 million contribution here. The whole point is to help low and middle-income countries get the tools and know-how to develop and produce their own life-saving medicines. And this is where it gets really interesting, because it's not just about, handing over a recipe and walking away. No, it's a whole structured program. First, they developed and validated the core mRNA vaccine platform. Then, and this is a huge milestone, they transferred that tech from one hub in South Africa, Afrigen, to another, BioGac. They proved the model actually works. The next step, roll it out to 14 more partners. The endgame is to empower entire regions to make their own vaccines, to be self-sufficient. And a top official at the WHO, Dr. Yukiko Nakatani, really nails the impact here. This isn't just about charity. It's a strategic move to build a much stronger, more resilient global health system. The goal, as she says, is to have sustainable manufacturing in the places it's needed most. Why?
because that helps build a safer, fairer world for all of us.
Okay, so we've got the smart funding, we've got the technology sharing, but Belgium is also playing a huge part in what might be the biggest piece of this puzzle, actually rewriting the international rulebook for how the world deals with a pandemic.
And the difference is just night and day. Think back to the old way during COVID-19. It was chaos, right? Information was all over the place, and we saw so much vaccine hoarding. The new pandemic agreement, which Belgium has been a huge champion for, is aiming for the total opposite. It's about creating a system built from the ground up on one principle: universal and equitable access for all. And at the very core of this new agreement is this incredibly powerful idea called One Health. It's this recognition that you can't protect human health in a vacuum. It's all connected. Our health is fundamentally linked to the health of animals and the environment. And taking that kind of big picture, holistic view, well, that's absolutely crucial if we want to stop future pandemics before they even get started.
So let's step back for a second. When you put all these pieces together, the smart funding, the tech transfer, the push for new global rules, what you're looking at isn't just foreign aid. It's something bigger. It's a blueprint for a whole new way of thinking about global partnership.
And their commitment is really broad. This isn't just about the next pandemic. Belgium's working with the WHO on strengthening entire health systems, ensuring access to all kinds of medicines, advancing sexual and reproductive health rights, fighting those neglected tropical diseases, and supporting moms and babies. They're investing in the very foundations of global health, and they're doing it quietly and effectively.
Which kind of leaves us with the final question to chew on. You know, in a world with so much tension and me-first thinking, this Belgian model of quiet, strategic, trust-based partnership, it almost feels radical. It's less about making big, loud gestures and more about just building a system that actually works for everyone. So you have to wonder, is this the future of global cooperation we've been looking for?